Bonjour.
Bonjour.
Bonjour, je m'appelle Rebecca.
The French customer service scandal at UnitedHealthcare is kind of juicy drama if you are a Medicare nerd. So first of all, star ratings. We're going to talk about star ratings in this show.
This episode.
This fascinating show about Medicare star ratings.
So last year, we had 38 5-star rated plans.
And it went down to only 7 5-star rated plans. So those plans, those 31 plans that are no longer 5 stars, they're not getting as much money as they got last year from the federal government. So when plans are competing, if you're a 3.5 star versus a 5 star, you get 5 stars getting a lot more money. They can have richer dental. They can have more give back. So it's right. It's how you stay competitive.
And we're seeing an uptick in the 3.5 stars.
Yeah. So last year we had 130, about 130, 3.5, and now we have like almost 160. So it's not horrible, but still, if you're a 3 star for 3 years or more, what happens?
You're out. Game over.
What does that mean?
You cannot write business anymore. So we saw WellCare last year lost North Carolina. Or North Carolina kicked them out for having 3 stars.
It happens every year. It's kind of quiet when people lose.
Yeah.
It's loud for the people in that state, right? But it happens every year that somebody is underperformed. I think that's a great system. If your ratings aren't good enough for 3 years, go take a break.
Right.
And you're not losing the whole country, you're losing that state.
Mm-hmm.
So let's talk about UnitedHealthcare suing CMS over their methodology.
So from what we understand, if somebody calls in speaking a different language, the carrier has 8 minutes to provide an interpreter.
So for the star ratings, there's different measurements. So the call center measurement, to get 5 stars, you have to do certain things. But one of the things is if somebody calls in a foreign language, you got to get them an interpreter in 8 minutes. So somebody called UnitedHealthcare
In French.
because
that's a big language.
But
here.
apparently they didn't say, like, can I have an interpreter? They didn't do something they were supposed to do that a caller would do. So UnitedHealthcare's person that answered didn't get him an interpreter in 8 minutes. And so UnitedHealthcare is saying, well, you didn't ask for an interpreter.
Probably something like, do you speak English?
And the government's saying, well, if they spoke French, you should have extrapolated they needed an interpreter. Anyway, right. Because of that one call that lasted less than 10 minutes, UnitedHealthcare will lose millions of dollars. So heck yeah, they're going to sue them.
Heck yeah, they should sue. That
is crazy.
I would say something bad in French, but I don't know how.
And Elevance sued last year, and Scan sued last year. When Scan won that lawsuit, then all the Elevance got a lot more money. Scan, and then they were allowed to refile their bids last year because they got more money. So this whole thing with the star rating, I think there's a good heart behind it, trying to give people an idea. But give me a break.
Give me a break.
One 10-minute call costs you millions of dollars, right?
That's nuts.
So at least you have some better idea the value of the star ratings, because if your clients are happy, they get those surveys after a surgery, they need to say they're happy. Right.
And it's probably good to be, you always want to work with plans that are best for the customer, which I'm going to assume those with the highest star ratings.
They're
going to have the better benefits.
Their member feedback is a big part of those star ratings. So I hope that helps somebody out there, especially the new agents that weren't really sure all that worked. Au revoir. Watch this next video with one of our great partners that's helped hundreds of insurance agents, Medicare insurance agents all across the country. They've been working with independent agents for several years with a wonderful lead program. This video is perfect for some of you out there looking for an answer to your lead questions.
Enjoy.
As an insurance advisor, you face many challenges getting access to the resources you need to be successful, especially if you're an independent advisor. Most advisors' needs will change as their business grows, and eventually, marketing will become your biggest hurdle to a 6-figure practice. Gordon Marketing agents have access to a turnkey, proven marketing system that targets prospects approaching their initial Medicare enrollment. You can expect to be introduced to 20 to 30 new Medicare prospects a month with our program. All marketing and materials are done for you. All you need to do is show up and present to a room full of prospects. Our team creates each agent a company-branded presentation deck, marketing pieces, and a landing page that will reflect your company and branding. Each agent also gets a client-facing monthly newsletter to help support and grow their book of business. Lastly, and one of the best aspects of the program, is the ongoing coaching and mentoring sessions with successful agents in the program. If you think you're ready to start marketing for Medicare, but you don't know where to start, let us save you time and money with our proven marketing program.